Hello, everyone. Welcome to part one of the Understanding Health Insurance series. This video covers the basics of health insurance, including identifying the different types of health insurance plans and some important key terms that will help you to understand your health insurance policy better. So we'll first start out with some key terms, premiums, deductibles, and out-of-pocket max. Knowing these terms are incredibly helpful for understanding the ins and outs of your policy. So starting with premiums, those are monthly fees paid for health insurance coverage. So for example, you pay $300 per month for your health insurance, just like you'd pay for a streaming service each month. It gives you access to your health insurance. Next, there is the deductible, which is the amount that you must pay out of pocket before insurance starts covering costs. So, for example, your plan has a $1,000 deductible. So it's similar to a deductible on a car insurance where you pay the first $1,000 if there is an accident. It is important to note that monthly premiums do not apply to the deductible. The premium is what you pay just to have the insurance. Only medical services apply to the deductible. Also, the more you pay for your monthly premium, the lower your deductible will be. So if you have a $450 premium, your deductible could be $400. If it's $300, it could be $1,000. And if it's $150, it could be $2,000. Next, there is the out-of-pocket max. This is the maximum amount you'll have to pay for covered medical expenses in a plan year. So once you reach this limit, your insurance covers 100% of eligible costs. So for example, if your out-of-pocket max is $5,000, think of it sort of like a safety net. Once you've spent $5,000, your insurance takes care of the rest. And of course, that is going to be policy dependent, so always check your policy just to see if there's any specific limitations. Once you meet that maximum, you will not pay any more money. This typically includes doctor's visits, hospital stays, ambulance rides, etc. The last two key terms we're going to cover include copays and coinsurance. They sound similar, but are actually very different and determine the amount of money you pay when you need treatment. First, there are copays. These are fixed amounts of money paid for specific services or prescriptions, often at the time of care. For example, let's say you go to your primary care doctor and pay $20 each time you go. That is a copay. Think of it as the same as buying a movie ticket on a Friday evening. You'll pay $15 each time you go. Then there is coinsurance. This is the percentage of costs you and your insurance share. For example, you might see this as, let's say, like 80/20, which would be your insurance pays for 80% of it, and you would pay for 20%. Let's say you had an x-ray for a broken wrist before you met your deductible and you paid completely out of pocket. If you had another x-ray after your deductible was met, you'd only pay 20% of the cost. But as with everything else, this is policy specific. Most of the time, coinsurance starts after you meet your deductible, but there are times, like with visiting urgent care facilities, for example, where the coinsurance is 80/20 regardless if the deductible is met. Next, I will cover tiers of insurance. This is more important when choosing health insurance, and since we are focusing on understanding health insurance in this series, I will touch lightly on the concept, but it is a good thing to know when choosing health insurance and can help you understand your insurance type a little bit better. So there are 4 tiers of insurance. First, you have bronze. This is the cheapest insurance. They typically have low premiums and high deductibles, and there are high cost of care and fewer cost-sharing benefits, like insurance pays 60% and you pay 40% of the costs. According to healthcare.gov, this is a good choice if you want a low-cost way to protect yourself from worst-case medical scenarios like serious injuries or sickness, and your monthly premium will be low, but you'll have to pay for most routine care yourself. Next, there is the silver tier. This is a bit more expensive than bronze health plans. There are lower deductible costs than bronze, but they have a higher monthly premium. There are moderate costs when you need care and some cost-sharing benefits, like insurance pays 70% and you pay 30%. It's a good choice if you qualify for extra savings, or if not, you're willing to pay a slightly higher monthly premium than bronze to have more of your routine care covered. Next, you have the gold tier. This tier has a higher monthly premium but much lower deductibles. The cost you pay for healthcare costs are usually low. This has more cost sharing benefits, like insurance pays 80% and you pay 20% of costs. This is a good choice if you're willing to pay more each month to have more costs covered when you get medical treatment. So, if you use a lot of care, a gold plan could be a good value for you. Lastly, there is platinum. This has the highest monthly premium and the lowest deductibles. The costs you pay for healthcare are the lowest and has the most cost sharing benefits. So insurance would pay 90% and you would pay 10%. It's a good choice if you usually have a lot of care and are willing to pay a higher monthly premium, knowing nearly all other costs will be covered. So, the next section identifies the most common types of health insurance. You'll see here that I wrote them as their abbreviations because that is how you will most commonly see them. But I'll be covering HMOs, so that is health maintenance organizations, PPOs, known as preferred provider organizations, HDHP, high deductible health plans. I will also be mentioning 2 additional components of health insurance that are dependent on the type of plan. These are also known as HSAs, so health savings accounts, and FSAs, flexible spending accounts. So, 2 of the most popular types of health insurances are HMOs and PPOs. They are similar but have one main difference. An HMO requires you to see your primary care physician, also known as PCP, to be able to see specialists. So, let's say you're having wrist pain and need to see an orthopedist, a doctor who deals with bone injuries. First, to see one, you would have to go see your PCP for them to determine if you need to see a specialist. If they think so, they will send a referral to a orthopedist in your network. In comparison, a PPO allows you to see a specialist without seeing your PCP. So, using the previous example, if you're having wrist pain and you want to see an orthopedist, with a PPO plan, you can make an appointment yourself with an orthopedist in your network without your PCP's referral. So, the last 2 are HDHPs and HSAs. These 2 usually go hand in hand. So, the high deductible health plans, or HDHPs, have higher deductibles and lower premiums. So, for example, your deductible with an HMO might be about $2,000 with a monthly premium of $300. A high deductible health plan would be much higher deductible, let's say of about $4,000 with a lower monthly premium of $125. And they're often paired with the health savings accounts. So, a health savings account, HSA, is a tax advantage savings account for medical expenses. So this is typically taken out of your paycheck before taxes, and you can use this money to cover medical expenses instead of paying additional money out of pocket. So while a HDHP is a type of health insurance and HSA is not, it only accompanies health insurance plans. An FSA is a tax advantaged, so pre-taxes, account for medical expenses offered through employers, often with a use it or lose it provision. You can use funds in your FSA to pay for certain medical and dental expenses for you or your spouse if you're married and your dependents. And according to healthcare.gov, you can spend FSA funds to pay deductibles and co-payments, but not for insurance premiums. Spend it on prescription medications as well as over-the-counter medicines with a doctor's prescription. Reimbursements for insulin are allowed without a prescription. FSAs may also be used to cover cost of medical equipment like crutches, supplies like bandages, and diagnostic devices like blood sugar test kits. Make sure to contact your employer about using your FSA. Sometimes they do not provide you with information immediately, and you may have to contact them to get access to your account. I wanted to include a slide on the main differences between a health savings account and a flexible spending account, as these can be easy to mix up. They are both tax advantaged, so pre-tax accounts that can be used for costs such as deductibles, co-payments, co-insurance, some medications. But there are some major differences. So first, if you are self-employed, you can get an HSA account with another health insurance plan. Most of the time, this is going to be HDHP plans, but of course, it dependent on the plan and could be applied to other plan types as well. FSAs are specifically through employers. And because it is through your employer, you must choose how much you want them to take for your paycheck. And any contributions added to an HSA rolls over to the next year. So if you don't use all the money in the account, next year you can use it, and whatever you added to it the following year will add to the previous year's amount. But any contributions added to an FSA is lost at the end of the year. So like I mentioned in the previous slide, if you don't use it, you lose it. As I mentioned before, you must be enrolled in a HDHP or another type of health insurance plan, depending on what it is, to have a health savings account. That is all for part 1 of the Understanding Health Insurance series. Part 2 will include how to navigate your health insurance. Thank you for watching and supporting the Gwinnett County Public Library.